Welcome everyone to today's webinar. I'm Morgan Hafner with Becker's Hospital Review. We will begin today's webinar with a presentation and will have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Carrie Lykin leads Healthcare Strategy for Yext. She recently joined Yext from Google, where she spent the last 8.5 years building the hospital practice and working with healthcare organizations to drive patient and consumer acquisition. She holds a degree in public policy and political science from Duke University and a Master of Public Policy from the Harvard Kennedy School of Government, where she focused on health policy. Andrew Rainey leads the strategic growth of Binary Fountain, a leading provider of patient feedback management solutions. In his role, he engages marketing and patient experience leaders to understand and address their transparency, reputation management, and patient experience challenges. Andrew is a frequent speaker at industry events and is a co-author of the HIMSS book, Applying Social Media Technologies in Healthcare Environments. Carrie, I'll now turn the floor over to you.
Thanks, Morgan. We are so happy to be here today to deliver this webinar on the impact of first impressions on patient acquisition and revenue. Thank you all for joining. In today's webinar, we are going to cover 4 topics, and I will go ahead and read them step by step here. So the first that we'll cover are steps to creating a strategy that will help impact patient acquisition. The second is how to attract more patients by optimizing rich listings so that people can find your physicians and your locations. 3, the power of online ratings and reviews and why you need them to enhance the opportunity to acquire new patients. And 4, why taking a transparent approach to sharing information is vital to engaging these patients. So why don't we move on to the next slide and talk a little bit about why we titled this The Impact of First Impressions. So first impressions have many implications. And so what do we mean by these first impressions? They're everything. And think about what happens when you meet someone for the first time. You're making judgments without really even knowing it. And you think about, what are they wearing? How are they coming across to you? What languages are they using in their conversation with you? How does that come across to you? And if we were to extend this to how patients are seeing your information online, they're making assessments about your health system and about your providers, both consciously and subconsciously. And it makes it even more important to ensure that your first impression online is in tip-top shape, regardless of where they find you, because let's be honest, they're not always finding you on your owned properties. In my role at Google, we talked a lot about the patient journey, and the one thing I learned very early on in my many years there was that you can't control where that patient will find you, as I mentioned before. Many health systems think that the only place a patient is going to be exposed to the health system brand is on the health system website or in media you've positioned in the market. The fact is that your patients are digital, they're accessing information everywhere, and they could find information about you in those anywhere places online. So that information needs to be accurate and an accurate representation of your system, of your brand, and of your providers, wherever they might find you. Andrew, how are first impressions seen from your perspective?
Sure, thanks, Carrie. We really look at this in 2 different lenses, both on-site in terms of the first impression and more broadly in terms of the patient experience. And that was really the traditional approach, was when you thought about patient experience and that first impression, everyone thought that this was really just after a decision had been made and you're already going to seek care. But with new digital strategies and marketing initiatives, now you also have this online first impression, which is perhaps now equally as important as part of that overall patient journey. So what we've really done is we've tried to look at this through both of those lenses and really coming up with a holistic strategy and measuring that entire patient journey, not just when they have selected a provider, when they've selected a brand or a facility.
If we move on to the next slide, thank you very much, we can see that increasingly, too, with these first impressions and with the importance and the relevance of ensuring that you're not only marketing to a specific group and taking control of your own properties, you have the control outside of these different properties as well, but you still are responsible for increases. So thinking about the different increases in tracking, you could be increasing patient volume, and so measured against that. You want to increase revenue to the health system, and you're measured against that. So any activities you take could increase new patients, which is what we want to be talking about today, and also increasing market share, especially in highly competitive environments. So thinking about these different ways of tracking marketing, we want to make sure that we're helping you to optimize how we can help you increase all of these different metrics.
And just speaking to some of the shifts that we've seen in the market that have also had an impact on those marketing metrics, first being an increase in health insurance costs. And what this has really boiled down to is patients are now becoming much more selective. There's more and more information, and they are now an educated consumer. And as they're going online, obviously the cost of insurance, the cost of care, but also this is having an impact on what choices are being made online as well. I think you're going to see that most often the decision from a patient is happening at the physician level. It's no longer driven just by the overall brand or the hospital or maybe the clinic. Still important pieces to be tracking, but nonetheless, it's that physician level detail as part of that selection process. So now it's become more and more important for groups to really understand, well, you know, where does this decision take place, and what strategies and what methods can be in place in order to more effectively track what that overall patient journey is, and how do you influence then that overall decision. So both the increase in costs and then certainly the overall provider choice, and how do you optimize both. So Karen, let me bounce it back over to you for those last two.
Yeah, definitely. Thanks, Andrew. So two more things that we're noticing as market shifts have to do with healthcare data and the prevalence of that, and also the patient using that data and becoming far more educated about the providers, the systems, the treatments, everything that surrounds what that patient needs as far as it's related to the health care that the patient wants to receive. So the data, we think about just the mandate around the electronic medical records. Think about how much data you have now internally within your system to be able to now start tracking things like, is the patient a new patient? Is the patient newly billable, insurance billable because they're brand new into your system? Is it a returning patient? What kind of information is the marketing team using that's able to tap into that EMR, for example? What kind of information is the marketing team using outside of that? Lots of different information internally that is then also projected externally. So there's not only healthcare data that's being driven on the internal, but now there's so much more data outside online about procedures, costs of procedures, doctors who perform those procedures, and whether they do those procedures in a significantly positive manner or not. Articles about healthcare, the data is unbelievable. And then on top of that, the patient has access to this information more so than ever before. I was visiting with a health system last week, and the health system during the meeting had said, you know, it's really funny, the doctor will say to the patient, we're seeing this in so many different capacities, but the doctor will say to the patient, hey patient, you need to get XYZ treatment, you should go to this doctor. And the patient will go home and do some searches about that particular physician, but then also related physicians. And then they'll make an educated, basically a decision on whether they want to go to the physician that has been recommended to them by their doctor, or go to another one because they've read reviews that were more positive. They've seen that the particular physician they want to choose is actually closer to them and accepts their insurance. So there are lots of different ways that patients are now becoming so much more educated, and so they're far more in control of their health care, which means it's far more important to ensure that the information that you are presenting to the public, wherever that information might be, is accurate and in control on your end as well. So we talk about this as the patient journey. When I was at Google, we talked a lot about the patient journey and how it morphed from a desktop online journey to a mobile online journey. And regardless of whether it was on desktop or now it's on mobile, we're seeing that the patient journey has 4 steps, and that it usually starts with a symptom. So these 4 steps that we're going to describe dictate how the patient goes through a funnel all the way through to actually walking into a health system, into a provider's office, receiving care, and what happens after that. So the 4 steps are: number 1, discovery; number 2, selection; number 3, point of care; and number 4, feedback. So I like to think about the discovery piece as once a patient realizes that she has a symptom, she is going to search a lot about this symptom. So she tends to search on search engines, and I treat those search engines like the hub and spoke. The search engine, like Google, is the hub of a wheel, and the search engine points that patient to different websites, so into the spokes. So it might be healthcare publisher sites, might be articles, might be blogs, might even be social media. And the concept is they'll go back and forth from that hub to the spoke and then back again. So trying to hone and refine and decide whether that symptom needs an actual treatment. In that discovery process, the patient is also discovering different physicians who might be treating those symptoms that the patient is experiencing. So as we move from discovery to selection, the patient has a few different physician ideas of who she wants to visit. So she goes to the selection piece, and this piece is largely all about understanding the physician. Is the physician near me? Is the physician able to accept my insurance? What about the physician's ratings and reviews? How does that physician compare to other physicians? So not only is that patient using search engines again, but there's a lot of consultation with these healthcare directories and review sites. And then we move from selection all the way to point of care, which I will let Andrew describe.
And with the point of care, what we found is that it's very important to really understand the entire patient experience. So once you've showed up to the hospital or to the clinic for a procedure or for an appointment, it's, patient experience is no longer defined as simply the outcome, right? It's no longer just, I broke my arm, the doctor fixed it, so this must have been a 5-star experience, but rather there are all these other subcomponents that really need to be understood and ultimately measured, and so that way you can continually make these process improvements. And when we look at the patient experience at the point of care, this is not just centered around bedside manner or quality of the procedure. This is also around categories such as the friendliness of the staff, parking, wait times. These are all components that the average patient can legitimately relate to, and these are all critical components as part of that selection process as well. Why did they go and select that group in the first place, and then what experience are they having on their own? And that ultimately leads to that 4th component here and that 4th step of the patient journey, which is then also leaving feedback. I've now left the practice, I've left my appointment, and when I go home I want to leave some feedback, and there are some strategies that we can discuss today as to how can you drive more and more of that feedback. But after a patient has now left a review, positive or negative, about their overall experience, now this circles all the way back to that selection process. This is now a public-facing response, and it's no different than just posting that on a billboard for millions to see, and this is now going to affect future new patients and what selection they're going to be making in terms of that physician or the overall brand.
Yeah, Andrew, I like that we have created this as a cycle, as a circle, because feedback certainly does feed into that selection piece for another patient who might be experiencing similar symptoms. And I like to call this a perpetual patient journey or a closed loop system. It definitely is something where it does feed, it feeds itself and feeds into new opportunities for new patients. We also see this from John Weston, the former Chief Marketing Officer of Mayo Clinic. He basically laid it all out there. He said the consumer to patient journey is largely a digital journey at their moment of need. So that moment of need is that symptom or that diagnosis or whatever that might be that engages the patient or allows the patient to say, okay, it's time for me to start to do my research to figure out what is the best course of action for me or for my family. And then beyond that, we know that there's this statistic that 77% of patients are using search before making an appointment. So they are going to that hub and allowing that hub to send out to the different spokes. We also see that patients are using online reviews as a first step in finding a doctor. So this data point here is clearly showcasing that patients are consulting not only search, but they're also seeing that these online reviews have a big impact on their decision process. Why don't we go to the next slide? We also did a study at YEX where we wanted to better understand how healthcare providers were searched for. So not necessarily healthcare providers are searched for, but how people are searching for healthcare information. And what we found was that people who are looking for healthcare information in order to make an actual action, so to take an action, we found that these prospective patients were looking significantly more for the individual provider, like a doctor or a dentist, than they were for a physical location. And the interesting thing about that is that it definitely aligns with that patient journey. So the discovery to selection, moving into the selection piece, they're not looking for a location anymore, they're looking for that physician.
And this is something that we've also seen. It's I wasn't shocked when I saw the stats. A majority of the healthcare-specific review and rating sites are provider-specific. I mean, in some cases, you don't even have an opportunity to leave a review or a rating about your experience with the hospital or with the clinic, but it's only about your experience with the provider, and that obviously has its pros and cons. You know, the positive there is that now your physicians, which now represent the brand, are better represented. But on the flip side, now this creates a potential challenge where if a patient had negative things to say about their experience that have nothing to do with the provider, sometimes you're seeing some of these reviews being published on that provider's profile page. So it's really a matter of better understanding what those comments were, and were those reviews legitimately about their experience with the physician, or was this a broader experience with the overall brand or location?
The interesting thing, too, is that there are these experiences with the physician, and there are experiences with the location, and there are places where the patient, and I'm sure you have seen this too, where the patient doesn't blame where they found the information. So they don't blame Google where they found this information, they blame the health system. And so that is a big challenge for health systems to try to connect the dots and ensure that there is a seamless experience. But we also see that there are some pretty big consequences of not taking care of this. So I was visiting with a different health system last week, and we were taking a look at some location information just to see if we could ensure that a patient could get to a particular cardiology practice. What we found was that the information that was on Google and Yahoo, for example, showed this cardiology practice 2.5 miles away from the actual location. So my question is to them, how many times have they missed patients as a result of patients getting lost? They type in this location that they found online 2.5 miles away, so the patient drives up to that location, parks the car, goes into the location, realizes the cardiologist's office isn't there, then gets mad, tries to figure out where they need to go, gets back into their car, and then hopefully, but maybe not, hopefully drives to the actual location. The patient is angry, the patient may now be late, or the patient may not have showed up in the right location at all. And when we think about this just in a back of the envelope, back of the napkin calculation, how many times have you experienced a missed appointment or a patient no-show due to this incorrect information online? So if you were to charge $100 per visit for that patient, and I know a cardiology patient, you probably get more, but if you charge $100 per visit for each patient, and you get 2 patients no-show per day, and you multiply that out by 50 weeks, 5 days, 50 weeks, the cost to your health system is a minimum of $50,000 per year. How much of that could you bring back just by having the correct location information to ensure that no matter what, if a patient was searching, they could find you?
And another component of this, I know personally when I needed to seek care, I needed to find an urgent care center. I started my search in Maps, and I identified a number of urgent care centers that were in the area, but the reviews and ratings were also embedded there, and that also helped in leading to that ultimate decision. But this is one of those shifts that we mentioned previously. You have more and more feedback that's actively being published online, right? So burying your head in the sand is no longer a strategy. So the act of inaction, essentially. And what we're also seeing is that the more innovative systems, they've not only recognized the need to actively be monitoring what's being posted about them online, what is their legitimate online reputation, online presence, but they also need to be able to know and be able to measure, well, how does that stack up to competitors? I think traditionally with marketing and communications teams, they were looking at this through the lens of social mentions, so they could see, all right, well, how many followers do we have, and how many Facebook fans and so on do we have online, and how does that stack up maybe to other large brands or large health systems that were in the area? But what they were missing were those legitimate experiences. It's more than just an online mention, it's an online experience from these patients. So how do you create a competitive benchmark, and are you going to be confident if a patient were to sort of do a search today, and this is something that we're hearing from our groups when they go through this exercise, put themselves in the perspective of a new patient. If they were to do a search today, are you confident in what's already been said about you, your brand, and your physicians online? And are you also confident then in where that stacks up against competitors? I mean, you see some of these stats, 47% of patients are willing to go out of network based on some of these reviews. And what that tells us is not only are these reviews important and critical as part of that decision selection process, but patients are actually willing to potentially pay a premium in order to seek care with a better experience. So inaction is no longer a strategy. It used to be. So now many more systems are actively not only monitoring, but also doing some very in-depth benchmarking so they know where do they stack up online.
And Andrew, that's so interesting too, because in addition to reviews, we know how many patients tried to get in touch with a provider who had great reviews, but a bad online presence. What if they had a bad phone number or a bad website to take them to perhaps make an appointment? What happens then? And then on top of that, we're now starting to see on Google, if you're searching for a particular physician, if that physician comes up in the knowledge graph, you'll be able to scroll down and you can actually see physicians like Dr. Smith, and you can see other physicians listed there. So if you don't necessarily have the right information for a physician, you could opt to select a different one. And then does that mean that you've now lost that patient? So it's very critical to think about what is your patient acquisition strategy as it relates to what's outside of what you own, outside of what you've put out into the marketing ecosystem. And we've thought about a three-pronged approach to how to develop that strategy, which we'll share with you today. So we've divided this into own, influence, and maintain and optimize, because we feel like it's very important to think through these strategies in a step-by-step process. You can't eat the whole elephant without taking that one bite at a time. So why don't we move to own? So own, what do we mean by own? We mean you should be able to own your health system brand and your healthcare provider brands within that system, both on and off your owned online properties. So off maybe your micropages or landing pages, off your website URL, but what's happening outside of your website? This means gaining control. So you just need to understand, how do you make sure that you prioritize where information falls outside of your website, and then how do you gain control of that? So you want to ensure that your physical location data for each physician and your facility location data is clean across key publisher sites. So that means things like ensuring that you know and have prioritized which sites, which we'll list on the next slide, which sites to optimize. Second is, for each of those sites, think about how do you log in, and then how do you claim all of these different locations and physician locations on those sites. And how do you just ensure that the name, address, and phone number is correct across all of those sites? And the interesting piece to this is that out of the almost 80 health systems I have visited over the last 6 or 7 months, there isn't always, in fact, I would say 99% of the time, there isn't always a central source of information internally within a health system that can help then populate this information outside on these different sites. So it's also very important to understand, where does that physician information and your physical location, where does that live within your system? And then how do you take that information and ensure that for each of the sites you've prioritized, that information is correctly reflected out there?
And Carrie, you brought up a good point before as well, where marketing communications teams, team PR, they're spending all these marketing dollars to really guide that journey online, right? And if I'm a patient, I do this search, and I were to come across I've narrowed it down to 3 overall physicians. What am I likely to see? What is that zero moment of truth once I've conducted that initial search, right? And if I then go and I find that there have been a number of negative reviews that have been posted for one of these individual physicians, or maybe for the brand in general, I'm now going to be detracted. I may have all of my listing information that's accurate across the board, which led to that over SEO, which led me to those pages in the first place. But if the reviews and ratings, if there's a disconnect, right? If now there's a number of negative reviews, or if I'm not going to be as likely to select, that obviously will have an impact on the overall bottom line and ultimately that patient acquisition. But on the flip side, right, if you've now spent all this time, money, and energy in aggregating and monitoring all the reviews and ratings, you have a handle on it, and the patient then has made the decision, yes, this looks great. There's positive reviews. I was recommended here. They take my insurance. They're in my area. But then the phone number is inaccurate, or maybe the URL is inaccurate. That now has a negative impact on my overall experience, and that ultimately is that digital first impression that we mentioned before. So as part of that owning process, we always recommend that you start with what's already out there, both in the perspective of the listings, but certainly in the perspective of the online reviews and ratings, because that's very evident. It's very easy for a patient to immediately see what is the average star rating on a 5-point scale once they've done that search without even clicking through. So we always say baseline your online reputation. Where do you start? Where do you stand today? And then you can start to make those process improvements.
And that's so true, Andrew. You can do this too on these 4 different categories of sites. So I wanted to share this with you just so that you could start to think about where to prioritize your time. When we visit with these different health systems, they just say, we're so busy, we can't do it all. But the challenge is that you almost have to do it all because the patient can find you in so many places, and you can't control where the patient goes. So when we think about this, we think about it in these 4 categories. Category 1 would be search engines, so prioritizing Google and Bing and Yahoo. They comprise over 90% of all of the searches that happen, both on mobile and desktop. So it's important to make sure that your information is correct there. The second is the maps, which is very interesting, and we find this with health systems all the time, that they're having a lot of problems, especially with Apple Maps, because the information is incorrect, or they can't actually take a secondary pin and pin parking, for example, or pin a front door that might be different from the ER. So ensuring that your information is correct on Google Maps and Apple Maps is extremely important, both to just ensure that that data is clean, but also that your patient can get to you. Third is social. So we hear a lot about this with Facebook, Instagram, Foursquare, and Twitter. Facebook in particular, we have people who check in, but then we also have these rogue pages that show up. So how do you keep control of that? You need to figure out how to tamp those down a bit. And then finally, review sites, and those are in healthcare specific and non-healthcare specific. So sites like Yelp, where doctors are being reviewed, Vitals, Wellness.com, HealthGrades. I'm just listing a good number of them here. You Compare Healthcare, RateMDs. What we've heard is that not every health system prioritizes different healthcare specific and non-healthcare specific review sites in the same way. So we wanted to list all of the really, really important ones out there, and you can make the choice on which ones should be the priority. I think it's also very important from the review perspective too, to ensure that not only is that location data correct, but also the review data correct. Wouldn't you say that's right, Andrew?
Yeah, I mean, in the example I gave before, I literally sliced my finger. I needed to go to an urgent care group, right? And my search started in Apple Maps. okay? I didn't even start with a mobile-based browser, but rather I just went directly into Apple Maps and I just searched for urgent care. So that way I knew it would be near me. If the location didn't show up in the first place, they're not even part of the selection process, right? And then number two, Yelp reviews are now integrated as part of Apple Maps for each and every one of those facilities that's being hit. So the secondary component then was, all right, well, here's 3 that are in the area that are close by that are all open because I can see the hours of operation. But the reviews were then that final decision-making process for me, myself personally, before making a decision as to where I was going to go, right? So it wasn't an emergency in the sense that I had to leave right then and there, but I did need to make a selection and head out within the next couple of minutes. So I had the time to then make that informed decision. And you also brought up a good point in really managing those at an individual page level. So for each page and where you have a listing, either at the physician or for the facility or all the way up for the general brand on Yelp, on Vitals, and some of these others, once you've had an opportunity to claim these, not only are you then able to start monitoring these, but it gives you the ability to then start engaging. Right. And that's been one of the primary changes that we've also seen in the context of online patient experiences. And this is really tied to this next stage here, which is on overall influence. Groups have now moved from a pure social strategy to now an engagement strategy as well. We'd mentioned this before as part of that owning process. Yes, I mean, as a baseline, you need to be monitoring, you need to make sure that your listings are accurate and that you have a grasp as to what's being said about you online. But, you know, what can you do about it, right? So with online reviews and ratings that have already happened, we get the question a lot. All right, well, you know, what does Binary and Yext do about removing online reviews and ratings? Well, we don't, right? I mean, that's not what this is about. Welcome to the world of social media. This is about really taking these comments as what they are. They're legitimate online patient experiences. And if you're able to respond back to that individual patient, treat it no differently than if this patient was telling you face-to-face, right? Resolve the issue, find out more about what happened, and that's part of an engagement strategy. So having a public-facing online response that other people can see, but at the same time, you're also addressing a specific issue. But we always recommend having a more of a general response where you're saying, I'm sorry to hear that you had a negative experience with wait time, for example. Give us a call at this number, or you know, send us an email so that way we can find out a little bit more what happened. So you're being very mindful of HIPAA compliance. You have a public-facing response, and guess what? New patients are going to see that, and that then has an effect on building loyalty with that individual patient, but obviously for new patients to see. And the second component there is turning CAHPS surveys into online ratings and reviews. This is all about transparency. And this has one of the most immediate impacts that we've seen in terms of online reputation and online presence in the context of reviews and ratings. You're already collecting the surveys if you're a hospital or health system, in some cases the clinician groups, transforming that into a star rating after you've approved these comments and making these available online, the positives, the negatives, the whole 9 yards, and optimizing this for Google. So when I do a search, it's your site that's coming up. This allows you to take control of that conversation and legitimately influence that overall journey. We want our own systems to be number one in those search results, and we want the star rating visible so that way they can make that selection.
That's so true. So when we think about the patient journey too, when we think about those 4 steps, the feedback step being the 4th step, feeding into selection, Andrew, what you talk about couldn't be more important. And I think as that patient is looking at the selection piece, not only are they looking at the reviews specifically, but they're also looking at the location information. Is that physician near me? And what we see consistently is that health systems are just letting their data be scraped and be collected at random, and then it pops up in ways that they don't necessarily support. It's not in support of the brand, but there's a really truly great opportunity to ensure that there are far more rich listings out there that could provide that patient with an increased sense of a good first impression. So can the patient find you at your physical location? Can the patient call the right number, make an appointment? But also, can the patient see additional information so as they're doing research on that physician, they see the reviews and they also see all of this other rich content that could help them make a decision, such as things like, does this doctor accept my insurance? Where did this doctor go to school? Is this doctor a male or female? That's a very big consideration for a lot of health systems. So in the next slide, as we talk a little bit about how you can use rich listings to attract patients, you can not only ensure that you have the accurate name, address, and phone number, because those are the basics. You want to make sure that you covered the basics. But what are these other enhanced physician-specific content types? What are they like, and what should you be thinking about as you are looking to take all those sites and those publisher sites that we mentioned earlier? How are you going to make sure you've uploaded all of that information onto those sites? So you want to think about qualification and experience, the degrees. Where did the physician go to school, go to medical school, do fellowship, do residency, do internship, do any post-fellowship work, any board certifications? What kind of insurance does this physician accept? This is a big challenge. A lot of times physicians don't even know what insurances they accept, and a lot of times health systems accept insurance on one day and then reject the insurance the next day. So how do you keep track of all of that? But that's really important to the patient. Gender, as I mentioned before. And then is there a physician description or bio? People really love, as they're searching for their providers, they want to get to know the physician a little bit more through that bio. Physician headshot, as I mentioned before, that helps with gender, but also it just helps to humanize that physician. Procedures performed and conditions treated, that's, as Andrew was mentioning before with the reviews and impacting SEO, this also impacts SEO as well. So as you think about a strategy that incorporates understanding how do you get your owned properties to rise in the search engine results page, conditions treated, procedures performed, ratings, all of these different elements are part of what the algorithm is that Google in particular is evaluating. How do we get that to amplify so that that physician shows up before any other third-party site? Let's move on to the next slide. Oh, go ahead, Andrew. Sorry.
I was just going to say, what I always find interesting is, the social, but also the more specific, the review and rating sites have always taken that in mind, that the end user has always been the patient. Now the patient is the consumer here. So it was always important for them to have that information. That's why you see those as standard data elements that are part of that overall listing. But we're also starting to see, or we've absolutely seen now, these health systems as they've gone through a redesign of their own website and their Find a Doc and Physician Directory. These are all pieces that are being taken into account as well. These websites, the newer websites that are now popping up for health systems and hospitals are very much consumer driven. And it's the little changes that make the most impact. And it's sometimes as simple as having a physician photo, like a nice high-res photo of the physician as opposed to just saying the name. It makes it more personal, and that's ultimately what leads to that overall conversion or that ultimate click-through. Sorry, I didn't mean to interrupt you there, Carrie.
That's okay. I think it makes a nice transition because we think about what is that patient's first impression of you and how does that relate to the rich listing. As you can see on the right-hand screenshot, there is a photo there. And so when we look first at a poor first impression at a listing here for a physician, we see that this is just basic information, but it's missing so much. And when we think about it, it's missing a photo, it's missing a logo. It has incorrect naming convention. So when you look at just the way that Robert Tivisar, MD, Children's Hospital, Minnesota, I mean, think about that as a reflection of a health system brand. It has an incorrect website, which you can't see very well here, but if you were to click through it, it doesn't even take you to this particular listing website. There's no bio, no enhanced content. There's no featured message. There's no verification that this is a controlled listing even, and there's no description of the health system. That is a poor first impression, and that might be the place where a patient finds this physician. So now the question is, what does that patient think of not only the health system, but of the provider? If we look to the right, we see that this gives a much more positive first impression. It has everything that we talked about the other screenshot did not have, everything from that headshot to the logo to a couple of photos of the actual system itself. There's a bio on the right. We have the right phone number, the correct website URL. We even have, it showcases ratings and stars as well, and it's a reflection here you can see of Yelp. And we see the actual address. We also see a featured message. So we're giving that patient every opportunity here via this positive first impression they're receiving to contact by phone, by featured message, by website click, by directions, whatever it is that patient needs in that moment in time. This is a rich opportunity to get that patient to basically seal the deal, walk in the door and take care of that appointment. We can move on to the next slide too. So I just wanted to share that we worked with Steward Healthcare to, technically speaking, clean up the bad first impressions so that we could make better first impressions for them. And we saw that they had a 40% lift in search impressions just by listing all of their physician information on third-party sites. So they weren't just haphazardly showing up, they now had control of everything. So they now could show in a very competitive Boston market, I might add, that they were able to ensure that their physicians and providers showed alongside other Harvard-affiliated physicians and providers. And then on top of that, we were able to drive a 44% increase in doctor profile views. And the interesting thing about that was what Andrew had mentioned before, is giving your site the opportunity to get the traffic, right? So bringing the people to the doctor profile view, which then allows you to control how to close the patient, how to get the patient to make an appointment, how to get a patient to, if you have the functionality, schedule an appointment online. But mostly ensure that you can get that patient to take an action, and then you can always follow up later to ensure that that patient walks in the door. So we can see that the Chief Marketing Officer of Steward, Brian Carty, said that they've clearly shown that Steward can expand the top of its marketing funnel, and now they're getting many more qualified leads for appointments. And at the end of the day, that's really what we want to help to do, is to drive more patients to a health system.
I wanted to circle back on two of the other points that we've made, both on the engagement strategy as part of influence, and then certainly as part of the transparency initiatives for a health system. We'll start with engagement. This was just a perfect example. This is something that was taken from Yelp. And if you all are familiar with Yelp, Yelp allows you to update a review, which is a great feature for a number of reasons. But if you see here, if you look at the bottom, it shows what the original comment was. Right, so it shows this was the previous review. You can see that this husband took his wife to the ER, and obviously the staff was rude and so on. So a number of things that just did not go as expected, or it was just ultimately a negative experience altogether, right? Previously, if the system was not monitoring, they would not have otherwise known that this was even there, right? And something else to note is often you'll see that this useful, funny, or cool, there's these little tags that people can start to, it's very similar to a Facebook or something coming up and liking a comment, right? Which ultimately shows you, hey, how many other eyeballs saw this and what kind of an impact did it have. These are already out there, they're live, and you need to be aware of what's being posted. But when it then gets to that engagement strategy, you can see in their updated review, this patient, unprompted, went and posted an updated review to their original, and you can see exactly what happened. The director of ER spoke to me personally over the phone and addressed my concerns. So they were alerted of this online review that was posted on Yelp. They personally reached out to this particular patient by connecting the dots. And then they made process improvements internally. So you can see when this person then went back, my wife was again experiencing some pain. We decided to give her another unbiased try, a much better experience than before. We made the effort to improve the overall ER experience. Good for them. 4-star rating. This shows that updated review. A perfect example of that closing the loop. Online review that had been previously posted for others to see, but here's what I'm going to see as a new prospective patient. I'm going to see that, yes, it was initially a negative experience, but guess what? It's gotten better, and this is now a resolved issue for the system, right? Having that engagement strategy is incredibly important in building that overall patient loyalty, but also making that seen for other new patients. The other impact that we mentioned was on transparency. One thing I want to emphasize here, this is on posting positive and negatives. You don't want a physician, every single one of your physicians, to be 5 stars because you're only posting the positive reviews on your own site. You need to maintain the credibility and the transparency of the feedback that's being published here. So I want to give an example of Providence here. Providence, you can see what their individual profile looks like on their own website, and they added this review section. Providence is only posting their official CAPS survey, and in their case, they happen to be using Press Ganey surveys for their CAPS survey. This is then being transformed into a 5-star rating, and Providence is now actually publishing this onto their own live site. But you can see what the impact has on this. Now, we've talked a lot about driving feedback and traffic to your own website, but ratings and reviews is something that the average patient can absolutely relate to, and that's why it's so important to have on your own site in addition to monitoring what else is being said online. And part of the overall markup, in addition to a number of other factors that contribute towards website and SEO, is then the star rating. So on the right here, you can see if I were to do a search for this particular provider, for, in this case, Ruth Fisher Wright, you can see what's happening here. It's their own website that's popping up to the top. You can see that you have 261 reviews, and you have a visible star rating, and that's what ultimately drives those click-throughs. And, you know, ask yourself, I mean, what would you click? If I did this search, I've narrowed it down to maybe 2 or 3 doctors, with Ruth Fisher Wright happening to be one of them. I see 5 votes on Vitals. I see 32 on Health Grades. You know, Yelp would be pushed down farther and so on. But number one is their own website, which gives them the most control, controlling that conversation and the information that's presented to them. But it's also based on more reviews and more ratings that are made available. And that's why having a transparency initiative is so critical for ultimately influencing that digital patient journey and ultimately that first impression. And just some of the stats that Providence saw, so what were some of the outcomes as a result of launching a transparency initiative? So for their primary care, they saw a 25% increase in page views versus 29% increase for specialty care. And just to put those two in perspective, they're doing a number of other marketing initiatives. This is not the end all. Another number of other marketing initiatives that were also underway. For those that did not have star ratings, the providers that did not have star ratings on their site, they only saw about a 5% increase. So it's statistically relevant in terms of the impact these reviews and ratings had. And then of the patients that left feedback and patients that were looking at this, 87% found that the star ratings were in fact helpful, that they were looking at as part of their profile page. And 85% of the patients found the comments shared by the other patients to be very helpful as well. So reviews and ratings are important, not just across the third-party review and rating sites, but certainly on your own profile page. And this just happens to be one of many initiatives that have an immediate impact in measuring and maintaining an online reputation and presence.
And not just on the influence piece, but as we think through how the own and influence then leads into maintain and optimize. So Andrew was talking a lot about successes of the influence piece, and I spoke to some successes on the location data side, but you can't necessarily just think that once you fix it, it's one and done. There's a maintenance and there's an optimization component to this, and so it's important that there's a reputation monitoring component of this, as well as ensuring that location data is also accurate. So if you think about different use cases, the first might be managing feedback. There are constantly patients coming in and out of health systems on a daily basis, and how are you ensuring that your providers have enough recent online reviews to attract and basically go from that feedback point of the patient journey again to selection to influence somebody else's journey. So ensuring that as feedback is less, that feedback is collected and used appropriately, but also that feedback is not necessarily stagnant. Another piece is ensuring that physicians and their movement is properly tracked. So we see this a lot in physicians leaving health systems and also moving locations from within a health system. So moving from street A to street Z and having to move that physician's information online from street A location to street Z location. And then finally, with just overarching healthcare industry trends, we're seeing a lot of acquisitions, and we're also seeing system rebrands. So then what happens when the health system acquires another one or decides to do a rebrand? How do you make sure that if you're trying to do that acquisition and acquire that, let's say, smaller health system, that smaller health system now is a reflection of your brand? Or if you're rebranding, how do you ensure that as soon as you launch that rebrand, that's reflected not only in your marketing, not only in your logo, but now also everywhere else online? So there is a maintenance and an optimization component to this strategy. You own, then you influence, and then you're constantly looking to maintain. So then what does that look like as far as tracking some metrics against this strategy? If we go to the next slide, there are a lot of different ways that you can track this acquisition strategy, and we'll talk through just a couple of those. Mainly increasing patient acquisition being a very important one, but there are also other ones like increasing your online presence and brand and also patient experience. So thinking through the patient acquisition piece, did you increase the number of appointments scheduled by making sure that you've cleaned up all of your online physician location data, as well as improve your reviews presence? Did you increase traffic? Did you use, let's say, Google Analytics or another analytics tracking platform that you can now start to see a lift in traffic to, let's say, doctor profile pages? And then did you see increased calls to a call center? So we know that phone calls, for example, are much more what patients want to do to schedule an appointment as opposed to schedule an appointment using an online mechanism. We hope that that changes at some point, but right now, are you getting an increase in calls to the call center because now you have the appropriate phone number associated with that information or that physician? And then have you increased your online presence and brand? Andrew, I didn't know if you wanted to speak to some of that as well as to the patient experience.
Sure, I'll just highlight a couple so we have enough time for Q&A, but you know, some of the primary metrics as it relates to reputation management and overall online brand presence is, you know, the very simple metrics is what is the average number of online reviews and ratings that you have for each of your physicians, both before and after a transparency initiative as well, and what's already out there across the various sites, and where do you stack up against your competitors. And once you've launched a transparency initiative, or maybe if you have not even launched a transparency initiative, do a couple searches and see where do your physicians rank, right? Is it another third-party site that has the primary control, or is it your own that's still popping up to the top? And for patient experience, learn from the online reviews and ratings. Very often we'll hear negative criticism about online reviews and ratings. It's not a representative sample sometimes, or there's not enough feedback for us to make an operational decision, and sometimes that's true, right? But if you don't have a substantial number of reviews, ratings for that physician, that in itself is a problem, right? You might not be able to say, oh, well, we must have a bad bedside manner because of one online negative review, but what you could say is this physician is far less likely to be selected based on that digital patient journey than another physician that may have a slightly lower score but a more substantial number of reviews and ratings that are posted online. So not only posting all the, actually monitoring and aggregating and learning from all those online reviews, but also start bringing your own internal feedback and have a holistic view of patient experience, but legitimately read those comments. These are legitimate, actual, real patient reviews that are being published across the third-party sites and now your own website. The next step is to better understand and learn from it, because if you can improve the patient experience, it will be reflected online, okay? So let me pass it back over to you, Carrie.
Yeah, sure. Why don't we go to the next slide and we can just do a quick recap, because I think we do have a couple of questions that we'd love to be able to answer. But I wanted to just say that, you know, first impressions matter, and what I learned at Google and what we know now as well is that you can't control that patient's path to health. You don't know where they're going to find information about you. You don't know where they're going to necessarily be reading reviews. They're looking for phone numbers or physical addresses and locations. So it's really important that as you think about your health system's brand, you take so much pride and energy and effort in ensuring that that brand is a strong brand in the community. How do you make sure that it's just as strong online where the patient can find you? And then secondly, if you want to correct for this, which is a very important piece of ensuring that you can acquire those patients, is indeed correcting for it. Employ a management strategy for that. So practice the strategy of own, influence, and maintain and optimize so that you can increase those opportunities to acquire that patient wherever they might be, however they might find you, and then think about different ways that you can track success of that. The big piece here is that we gave you this strategy. We're super excited to help you, but Yext and Binary Fountain can also help you manage that as well. So if you are interested in learning a little bit more about what it is that we do, that we can help you enable, just easing into this in a fashion that might make things a lot more seamless, please do feel free to contact us. And Andrew, if you want to go to the next slide, our contact information is on that slide. Feel free to shoot us an email, and we'd be more than happy to set something up with you. And now for some Q&A.
Thank you, Carrie and Andrew, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled "Enter a question for staff" and clicking send. We will try to get through as many questions as we have time for. So for the first question, You list so many websites to take over in the Own section of your presentation. Improving physician data online is a seemingly monumental task. How should we prioritize taking care of our listings?
I think I'll go ahead and take that one. That's a really good question, and I think it goes to the concept of prioritization. So we gave you a list a few slides back, and we'll make sure that you get a copy of these slides, but a few slides back on the different sites and publisher sites that we would recommend prioritizing. What I would say is think first about search engines. So ensure that, because we know that 77% of people are searching online before making an appointment, and 81% of searches are actually unbranded searches. So just think about the search engines first. So ensure that you're prioritizing Google and Bing and Yahoo. Then on top of that, out of the people who are looking for healthcare online, and specifically providers, over 50% of those people are looking as well to healthcare-specific publisher sites. So I would definitely prioritize, aside from search engines, make sure you're prioritizing the healthcare publisher sites as well, because that not only reflects location data on sites like Vitals and Wellness and Healthgrades, for example, but they're also, that's where they're looking at reviews. And so you have to think about how do we make sure that we can also optimize to those as well. Andrew, I don't know if you have anything to add with that.
No, I mean, I agree with your assessment. I think that there are, I hate to place a priority on certain sites versus others, but at the end of the day, I mean, and especially, Carrie, you had mentioned it yourself, that you don't know where the patient's going to go. I mean, we also find that there are local blogs, like in the DC metro area, you have a group called DC Urban Moms, where there is just a ton of feedback from expectant or new mothers, where there's a lot of feedback and patient experiences that are being published. But you know, of course, you have your prominent sites that you know, really should take that first step. So the Yelps, the Facebooks, and like you said, Google, Bing, and Yahoo, and so on. And of course, your healthcare-specific rating sites like Vitals and RateMDs and ZocDoc and some of these others. But you know, once again, I hate to place priority because you really need to be monitoring. Sometimes you just don't know where these other reviews and ratings are being published, because ultimately that's still one patient, and they're taking that into account.
Yeah, you raise a good point about that. I think a lot of times health system groups are strapped for time, and so they can only prioritize a few sites. But what we can describe in the future is how all of those sites feed into one another. And so if you're taking control of a few sites, you might be taking control of it in the moment, but you're not necessarily fixing it for everything. So you have to think about all of the sites altogether. So Andrew, thank you. That is a very good point.
Thank you both for clarifying that. Great points. And so it looks like we have time for one more question. And so we've been receiving pushback from physicians internally about launching transparency. What's your recommendations?
Sure. And what I'm going to do is I'm going to couple that with another question that was raised, that was the process of going from CAPS to get that information in front of the customer. So this is all in the context of transparency. The reason that systems, there's about, I think it's about 50, just over 50 hospitals and health systems that have launched a transparency initiative at this point. I think 99% of them are all using CAPS data, and they do that because they know with 100% certainty that these are verified, legitimate patients, right? So what we've done is we take that CAPS data, and even more specifically, if you're using Press Ganey, it's an automatic feed into the system. There's an approval process. We take very specific questions that have been used, and once again, if you're using Press Ganey surveys, they have what they call a seal of integrity, which is a very thought-out, research-oriented methodology for calculating the star rating, so which questions should be contributing to that particular provider rating. And once they've been approved, they then go onto the live site. So there's still a rejection if there's PHI or profanity and so on. So that's how that process works for transparency. But I think it's an uncomfortable process for a physician. And if you put yourself in their shoes, it can be disheartening to think, oh, well, all of my reviews and ratings are now going to be made available on my own site. At the end of the day, though, you're already transparent. Review and rating sites are already out there. This is your opportunity to take control, and you're going to use it with a representative sample. Use a minimum of 30 reviews or ratings before it's published. A number of systems, and we recommend this, a number of systems have first launched transparency privately, internally, and they share the results with the physicians well before they start launching the star ratings on their own website. So it gives an added level of control. for the physicians to know what's to come. And ultimately, what we found is that a vast majority of the feedback is going to be positive in the first place, and we want physicians to be better represented online. So hopefully that answers both of those questions there.
Great. Yeah, thank you so much, Andrew, for answering that. Well, that is all the time we have for today. I want to thank Carrie and Andrew for their excellent presentation and to our audience for participating today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.